what we're going to talk about today is, what are the options for a patient that comes in? They've been struggling with their teeth for years. They've had loads and loads of dental work. None of it seems to last or work very well. Where we would typically go with something like that, we want to discuss three main options. One is getting rid of the teeth and doing a traditional denture. Traditional dentures have been around for years and years and years and years, and for some people they work really well. For other people, not so much. It's less expensive. There's surgery involved, definitely. Today we have other options. Option 2 is the implant retained denture. That's where this example is just a lower, where we put a couple of implants on the bottom. We build a lower denture that has the housings built into the denture. And when we put it in place, it snaps in place. The third option would be, it's called an All-On-4. It's an implant retained denture. It is similar to a denture, but it's actually screwed into implants that are placed in the mouth, whether that be on the upper or the lower. Recovery time, depending on how many teeth that are left and how much surgery we have to do, can be as little as a few days to being pretty sore for a few weeks. We usually have a visit or two where we're discussing the situation and getting a feel for what it takes, because people need to really understand before we go these next steps what we're getting into and what they really want. There could be fear of the surgery. Usually if it's a clinical issue, we can do IV sedation. They may be really concerned about costs. Before we ever make a move, we discuss all the finances and make sure that it's something that they feel comfortable with. Once we've established that the direction that we want to go is an All-On-4, we've already done a CT scan, we've done some model. The next step for me is to do pre-surgery, where we actually do the surgery on a computer. The day of the surgery, usually we're doing IV sedation, and then we take the teeth out. Usually I have a lab technician with me, and we get the prosthesis all ready to go for you, so that when you walk out, there's teeth. Recovery, usually you have to take it easy that day. The next day you might be sore, but we give you some pain medication. But most people tend to be able to do pretty much what they want to do the next day. What draws me to the All-On-4 is it really truly is as close as we can get to having a natural teeth. Not only in appearance, but in function. We're done worrying about decay. We're done worrying about cracked teeth. We're done worrying about missing teeth. Their dental care gets actually quite simple after we're done.